Madam President, people in prison continue to be left behind in COVID-19 responses. In many countries, they face heightened risks of contracting the virus and suffering fatal effects due to their poorer health status, cramped living conditions, and lack of hygiene supplies. Preventive measures like visitation bans have also had a severe impact on mental health, rehabilitation, and human rights, and have deepened the digital divide for those detained without online access or video call replacements. The pandemic has exposed the existing failure of prison systems, too often underfunded and understaffed, to meet even the most basic standards of healthcare. Already low healthcare resources and staff have been further stretched, affecting healthcare provision both for COVID-19 and other health conditions. Despite calls from OHCHR and other UN bodies to reduce prison populations in light of the pandemic, COVID-19 release schemes have not been sustained, and the overuse of imprisonment has continued, with prisons in 119 countries operating above capacity. As COVID-19 vaccination has begun in many countries, striking inequities in terms of vaccine allocations are apparent. Despite various guidance from WHO, PRI and others on the importance of prioritising prison populations and staff, only 55 countries explicitly include people in prison in their national vaccination plans. The limited information available due to concerning lack of transparency suggests that in many countries vaccination in prison has been slow, piecemeal and not accompanied by much needed information campaigns in detention settings, in many cases leading to high vaccine hesitancy rates. We urge the Council and Member States to uphold international standards and ensure that people in prison have access to the same standard of healthcare provided in the community, prioritise prison populations and staff for vaccination, and work to address the impact of pandemic responses on health in prisons, including by reducing prison populations and the use of imprisonment in the longer term. Thank you.